ankle mobilization. So what we're doing here is we are trying to get our calcaneus or our heel bone to move in a certain direction so we can get some more motion throughout the rest of our foot. There's a ton of joints that make up your foot complex. So when I say ankle mobilization, technically what I'm talking about is my shin bone moving on what's called my talus, or one of my, the bone that makes up the actual ankle joint. And then what we're doing here is we're manipulating your calcaneus bone, which is technically going to cause motion throughout the rest of the foot and not the ankle. And the idea here is we're trying to get your foot to pronate, which is going to cause tibial internal rotation, which is coupled with knee flexion. That's a bunch of mumbo jumbo. Essentially what we're doing is we're trying to give you a drill to clean up some of those biomechanics in your foot, which should alleviate. Oftentimes we'll see a lot of people that have like some like lateral or medial knee pain. This can kind of help clean that up. So for simplicity's sake, I'm going to use just 2 socks. And what I'm going to do is I'm going to fold one in half, and then I'm going to fold the other one into about thirds. And this is going to be different depending on your anatomy and your foot structure and those types of things. But what I want to do is I want to put the sock under my heel, and I want to put the secondary sock in the middle of my arch. And I'm going to use the squat rack here as a reference point or something that I can hold on to so I'm not worried about balance. Now when I get set up, I want to have my knee, my right knee is behind my left ankle. And I got probably 70% of my weight on my right foot, and I'm on my toe on my left foot. And what I'm going to try to do here is I'm going to push my right heel into the ground, relax my foot, and as I drive my knee toward the squat rack, I want to keep the weight into my heel. And then right when my knee starts to advance forward over my foot, I want to think about pushing my foot down, or my arch down, into that second sock. Relax my foot and let my knee drive as far forward as possible without having the weight transfer to the front of my foot. So if the weight transfers to the front of my foot, my heel pops up, now I'm going to have a rigid arch again, and it's going to change the loading mechanics, and I'm not going to be getting pronation. And oftentimes when people put a lot of weight on the front of their foot and they do this drill, they think that they're pushing into the sock because they can still feel it under their foot, but they'll start to develop some pressure or irritability in the front of the knee. If you're doing this right, you should be able to feel your quad working, and then like a stretch into your calf muscle. Shouldn't have any sort of like pain or pinch in the front of the ankle or in the front of the knee. So again, I'm going to get a sock under my heel. I'm going to roll up another sock to go into my arch. And when I put it into my arch, what I'm doing is I'm not putting it all the way across. I'm only putting it on the inside, about half, maybe a third or halfway. I'm going to start with my knee behind my ankle. I'm going to put heavy weight into my heel, relax my foot. As I start driving my knee forward, I want to push my arch down into that sock, and I'm going to drive my knee as far forward as possible without having my foot or my heel come off the ground, or without shifting the pressure into the front of my foot. And usually we're going to do that for time, just nice and slow, keeping that weight into your heel. If you do a couple bad reps to kind of give you some feedback, you'll again feel that pressure in the front of the ankle or in the front of the knee. We want you to feel it in your quad, or like a stretch through your Achilles or into your calf muscle.